I think we could go ahead and get started.
Okay.
I first of all wanted to thank everyone so much for filling out the midline survey for the mentorship program. The feedback was really, really helpful. And I actually think that the session today will address some of the feedback that the mentees provided. So that's really exciting. They wanted to hear from a career panel, which is exactly what we're doing today. And then I also wanted to remind people to keep sending me your one-on-one mentee mentor meeting times so that I can record that in our records. It seems like everyone is meeting and having really good sessions together, which is great. And then just a reminder that this program overall ends in August. So we have 2 more months and you have 2 more sessions with your mentees or mentors. And then we have 1 final group session at the end of August. And with that, I want to give us plenty of time for our panel today. So I'm going to hand it over to Greg to introduce himself and give us a bit of an introduction before our panel starts.
Great. Thank you, Emily. And to start with, I'd like to thank Emily for coordinating all of this. She's just done a fantastic job. So everyone, welcome to this group learning session for our Emerging Leaders in Contraceptive R&D project. My name is Greg Kopf. I'm the Director of Research and Development in the Product Development and Introduction Group at FHI 360. And I will be your moderator for this panel discussion where we have brought together colleagues working in the contraceptive R&D space with very different career paths. And the members of the panel include Kevin Peine, who's at USAID, and who would represent careers in the federal government and an R&D funding organization through the federal government. Kirsten Vogelsong of the Bill and Melinda Gates Foundation, who will give a foundation perspectives on careers, and is also, the Gates Foundation is also, as we know, a significant funder of R&D in the contraceptive space. Laneta Dorflinger, who's the director of the Product Development Introduction Group at FHI 360, and represents a career in the nonprofit NGO space. Luis Bahamondes at the Universidade Estadual de Campinas, who will represent academia, and myself, who can also weigh in on questions around career paths in academia and industry. So during the panel discussion, I will pose a series of general questions to the members of the panel to kick this session off. And after this general discussion, we will open it up to questions from all of you attending the session on the call. So I would ask you all to bring some great questions to this panel. It's a great opportunity to pick their brains around their career pathways and career development. But before we start the panel discussion, I would like to address several general points about developing your career. And that's regardless of the discipline that you're in. And I hope that these points will be helpful to you as you plan your next steps in your career progression. And so, Emily, can I have the next slide? So, as shown in this slide on the left, we're lucky in this panel to have most of these organizations represented. We don't have venture capital represented, but certainly this is an area for opportunity in the contraceptive R&D space. And on the right, I've just shown you some of the activities. This is not an inclusive list of areas within these different organizations that one could develop career interests in and be involved in. And certainly we may touch on these various aspects as the mentees have questions. Emily, next slide. So one of the things that I'd like to start off with is that there are a variety of components of your career development, and I've listed them here. And these are things that I think you should all be considering as you think about a career and strategies for developing your career. Certainly, we all have career aspirations. We're thinking about what we would like to do for the rest of our life in our working years, and we set goals. And many of you are at the process of doing your training, whether it be a graduate student, postdoc, or early development of a clinical position in, say, academia. So you're getting the information training to learn to ultimately develop a competitive advantage in the workplace, which is the next area that you need to think about. How do you develop a competitive advantage for yourself so that you are a great candidate for a future employee? And then how do you get yourself out into the workplace? How, what are the processes that you use to make yourself available to potential employers? And once you get to that point, talking about how you go about getting a job to align with your career interests. And I think there are important things to think about when you're interviewing and negotiating and closing a deal with a prospective employer. And then once you're in that position, a job, how do you go about obtaining leadership and management skills that will make you competitive for your next position? So you always want to be preparing for your next job. And throughout all of these components of your career development that you must be thinking about, what's critically important, and is that bottom arrow in red, is networking and developing a network of colleagues of interest. Now, I'm going to talk very briefly about a couple of these, but certainly we can pursue these in a little more detail during the subsequent discussions with the panel and any questions you might have. Next slide, please. So with regard to career management, a couple of things to think about, especially in these times, is that, the demand for different skills and expertise will force you as candidates entering the workplace to remake yourself on multiple occasions to increase your value to a prospective employer. And this can take many different forms. There are a variety of ways to obtain personal branding strategies. Many of you are in academia, or most of you are in academia now. Obviously, publishing articles is very important, participating in professional organizations where you can network with others. And in many cases, when you're attending meetings, there are potential employers there. Whether they be other scientists that are, looking for new faculty members at their institution, or companies that might be present, or the presence of foundations such as the Gates Foundations at the Society for the Study of Reproduction. So you can develop relationships with potential employers down the line. And it's important, I think, to focus your career and to be viewed not only as a specialist with great expertise in solving particular problems, i.e. your specific area of research, but also you need to develop the skills of an athlete so that you have a broad set of capabilities and the ability to experience and manage complexity in any job, because that the workplace is becoming increasingly competitive and more complex. Emily, next slide, please. I want to speak very briefly about the changing workplace, and I mentioned it very briefly in the last slide, is that, unlike, for instance, my father, who stayed in the same position his entire career, people no longer stay in the same job for their entire career. And a career path is not a linear thing. You're going to have ups and downs. You're going to go forward. You're going to go backwards. It's not a linear path necessarily. And alluding to the previous slide, you want to avoid becoming so specialized so that you can balance that specialist versus athlete type of criteria. I know that it's very difficult for folks to deal with change. But we are in the in the current times. We're at a state where you must be able to accept and embrace change and utilize that as a way to learn, to develop your career as if you're a one-person business. Next slide, please. Brief word about networking. And as I showed in that first slide, that red arrow that goes across the bottom, I think it's probably one of the single most important career development tools or resource that you can have. Your network is composed of all sorts of folks, whether they be family, friends, acquaintances, their networks, all integrated to make up your professional network. And I would strongly advise that you use a professionally oriented networking platform such as LinkedIn. Use that network for life, build and maintain your network, and always help members of your network, because they will reap, you will reap the rewards from it. And I can speak from personal experience on that one. One thing that I do want to emphasize is you want to be very prudent in how you use social networking platforms, because once that information is out, in the space, it's hard to pull it back. So network is an extremely important aspect of your career development over your entire career, I believe. Next slide. So a couple of comments about applying for positions and interviewing. Regardless of the type of organization you're interviewing for a job for, do your research. What does this organization do? Identify, places where you can get reviews on that organization. And if, for instance, if it's a private company or so, if you can find their financials, look into their financials, because it might speak to the stability of that company. When applying for a job, I think, many organizations now utilize online HR application portals. My personal opinion about that is that very often they're a black hole. So if you have an inside connection or can establish an inside connection, it's much to your advantage at this point. And when you are applying, along with your CV, have a letter of introduction as to why you are the best fit for their need. And I can't emphasize enough, it doesn't matter for the organization that you're applying for. Do your background research, find out about the organization, and ready yourself for the interview if you're lucky to get the interview. A comment about the CVs. One CV does not match every type of position that you're applying for. So tailor your CV to each type of position. This requires doing your research and trying to align the important aspects of your CV that makes your CV most impressive for a prospective employer to look at. And I would advise that you keep a master CV where you enter everything that you ever did, published, and keep that up to date. And then you can draw from that master CV to put into job-specific CVs when you're applying for a specific job. Comment about interviewing. If you do have an interview with a prospective employer, be very proactive. Come with specific questions that demonstrate your interest, even if you might not be the exact fit, because if you're not the exact fit, that potential interviewer might say, well, this person might be a better fit for another position within our organization. So, be very proactive, ask specific questions, and during that interview, emphasize how your skills would be a great fit to the organization. And I can't emphasize enough at the end, make sure you always write a thank you note to both HR and your interviewers. Next slide. And I think this is the last slide. So it's critical in my mind to be very entrepreneurial and innovative in developing your career. As I said, you're going to have multiple career paths during your working years. So embrace that change. Don't be afraid of change. You're a single person enterprise with specific skill sets, and you want to develop, identify, and constantly rethink the niche in your career area. That is, be very strategic and proactively plan. All of these opportunities, working from one job to another, help you to learn and keep learning. And so at the end of the day, find your passion. Do you want a career or do you just want a job? And with that, I'm going to, the last slide, open up the panel discussion with our four panelists and myself. And what I like to do is I'll pose a couple of specific questions to each of the panel members. And as an introduction, when they respond to these questions, please, panel member, just give a very brief background of yourself, where you've trained, the type of training that you've had, and how you've ended up in the position that you've gotten. So I think what we'll start the discussion with Kevin at USAID. And so Kevin, what initially sparked your interest in contraceptive technology and R&D?
Yeah, thanks, Greg. And glad to have this panel today. I come from a background, my PhD training is in molecular biology at Ohio State University. It was focused mostly on immunology and drug delivery systems. And then I did a postdoc at UNC Chapel Hill in the molecular pharmaceutics division, again, working on drug delivery systems for autoimmune and infectious diseases. So I actually came into a career in contraceptive R&D without any reproductive health background. After my postdoc, I applied and received American Association for the Advancement of Science, Science and Technology Policy Fellowship. And what that fellowship enables people to do is to come to DC and interview with a wide range of federal government agencies and find placement into a 1 or 2 year fellowship, mostly providing technical assistance, but also sort of as a professional development opportunity. And when I was interviewing around with all the different agencies ranging from defense to state to NIH and others, I think what struck me was the reproductive health R&D program at USAID. They were pursuing funding different studies and a lot of different drug delivery systems for hormonal contraception. And what I think particularly interested me was that a lot of those drug delivery systems were similar to ones that I was using for autoimmune and infectious diseases. And there's, of course, a whole range of people at USAID that have a reproductive health background. But I think one of the gaps at the time was that kind of drug delivery system engineering component. And at the end of the day, it's not too difficult, I think, conceptually to take an antigen or something like that out of one drug delivery system and replace it with a hormone. So I ended up taking the fellowship there to provide some of that background from my former life and have been there now, be going on 7 years with the biomedical team, first as a technical advisor and now as the team lead. But what I think is nice about the contraceptive space is because it's so small, I think you have a lot of people coming from diverse backgrounds, and it's really important to kind of find what part of your background that you can bring to the table to sort of further the contraceptive R&D space.
Great. Kevin, thanks so much for that perspective. Kirsten, I'll pose the same question. What initially sparked your interest in contraceptive R&D technologies?
Thanks, Greg. Thanks, everyone. And thanks, Kevin, for giving a little bit of the background of the AAAS program, Science and Policy program. So unlike Kevin, I also have a PhD in the sciences. Unlike Kevin, my PhD is in reproductive physiology and reproductive sciences. And one of the things, working in an academic lab during my graduate career, grant proposals always include what's, I think at times sort of a write-off line. But this work may be relevant to the development of new contraceptives or may be relevant to treatments for infertility. And, while that could have been a write-off line in order for, justification to receive a grant from NIH or another funder, that was what really stuck to me. What am I going to be doing with this knowledge in reproductive biology, reproductive sciences? So, studying neuroendocrine regulation of reproduction, reviewing these grant proposals, writing grant proposals of my own, this sort of throwaway line, write-off line, ultimately became more interesting to me than the basic science research that was occupying 120% of my day-to-day existence. So like Kevin, I also applied for and received a AAAS fellowship, and did my 2-year fellowship at USAID in the Office of Population, what was at the time the research division, and went from, again, lab sciences, animal studies, increasingly smaller aperture on the world of the biology of reproduction. Working at USAID, I describe it as, looking up from the lab bench and suddenly the world is your petri dish, right? So you have, you're really going from looking at cellular mechanisms to people and how people are behaving, and the bringing that science and the scientific expertise that you have to actually contribute to human development and the benefit of society in a large way. So I never looked back from that. I never went back and did my postdoc. I went from USAID to the World Health Organization in Geneva, supported biomedical and epidemiological research at WHO for 11 years. And then 10 years ago, made the move to the Gates Foundation. So really have gone from that, lab setting to a career specifically devoted to funding R&D for new contraceptive methods for men, women, and couples in low resource settings.
Great. Thanks, Kirsten. That's terrific. Luis.
Thank you, Gregory, and good morning or good afternoon to all of them. I am MD, and after my graduation, I performed residency in OBGYN. And the expected role of the Society for a doctor that specializes in obstetric and gynecology is to see patients and to perform surgery. And this is the reality. But after my residency, I was invited to join a position as assistant professor at the University of Campinas. And I was allocated to improve and to attend infertility women, the infertility clinic. And at the beginning, I worked in infertility for many, many years. But early, I discovered that they are not future in infertility, because the public sector in Brazil don't like to spend money in gonadotropins, in vitro fertilization, etc., etc. And I was shifting slow from infertility to contraception, which I started working contraception in Argentina at the beginning of my MD. I work in the IPPF clinic based in Córdoba, in Argentina. This clinic received a bomb during the military coup after the 76, and the clinic was closed. And I lived in Mexico for some years, and I worked a lot in contraception, because at that time was the program of family planning in Mexico, which was a disaster, but allow me to see what important is contraception in the women's life. And in addition, why I perform research, because at that time, they are not internet, and we read the journals in paper, and the library of the hospital was open until midnight to allow doctors to read the journals at the hospital. And amazing, I started at that time to subscribe contraception, fertility and sterility, and another journal. And I have this journal in paper until today, although some of them are not longer in paper. And when I start to read scientific paper, I open my mind. And I think so that red paper open your mind, because you discover how many questions don't have answer. And you see in your place of work if you are able to answer or not this question. And for this reason, I work in contraception for many years, well, until today in the University of Campinas. And as you said, Gregory, I work in only one institution all my life at University of Campinas, like my father, who worked for until he passed away in one institution in Argentina. But I be enthusiastic about contraception when I saw in Brazil and in Mexico the high rate of maternal mortality, the low rate of contraceptive prevalence, the need of women to receive a contraceptive method. And this is my main interest in contraception, which, as you know, in Brazil, in Argentina, in Latin America in general, contraception is not interest for MD. The MD are more interested in vitro fertilization, breast cancer, or urinary incontinence, but contraception is a marginal activity, and they are now a big interest in the large institution in Latin America. Thank you very much.
Thank you, Luis. Laneta, what initially sparked your interest in contraceptive R&D, and a little bit about your background as well?
Yeah, thanks, Greg. And I think you'll see a little bit of overlap between Kirsten and Kevin and myself, and even you, Greg. So I did a PhD in reproductive physiology at Yale. And I actually didn't go to Yale to do that. I went there to be to study neuroscience. And I ended up taking a class with one of the real fathers of gynecologic endocrinology, Leon Spiroff, who captivated me and and my interest. And so I ended up working in, not in his lab, but in another lab, looking at ovarian function. I was, from there, I went on to do my postdoctoral training at Harvard School of Public Health. I was working on pituitary function, but began to be immersed a little bit in public health. But I still had the idea that my track was going to be in the university setting, in academia, studying reproductive physiology. But after my postdoc, or during my postdoc, I realized that it was kind of the nadir of opportunities, not a lot of jobs available. So I applied for a fellowship, which was actually fairly new at that time, which you heard Kevin and Kirsten. It was called in those days the Science, Engineering, and Diplomacy Fellows Program. And I was accepted into that. There were 2 or 3 fellows that year, and I was the first fellow to be in the Office of Population. And I landed there. They at that point did not have anybody that really had the technologic background that I had, although there were physicians and others doing family planning programming. And so within 2 weeks of arriving, I was given a portfolio, and I was sent to New York to begin to have my 2 years of management of that portfolio. And it turned out to be the Population Council's grant from USAID. And in my portfolio was Norplant, Jadel, Mirena, vaginal rings, reproductive immunology. I mean, it was like a candy shop, every day was exciting. Every aspect of the development program was exciting. And I was completely hooked. And at the end of the 2 years I was offered a full-time position at USAID, and I stayed there for a totality of about 7 years. And I don't know, I might still be there, but for the fact that I had, my husband and I had been commuting for 4 years between Denver and Washington, and that was working out better for me than it was for him. So we ended up, because I was so excited about the work that I did. So we ended up moving to North Carolina to be together, and he had been offered a job at UNC, and he's a breast cancer specialist. And so then I ended up working as a consultant for a year, and then being offered a job at FHI 360 in their technology development program, and actually I entered through as the director of regulatory affairs, and then kind of grew. So I've actually been at FHI 360 doing contraceptive technology development, introduction, family planning, programming, and for a while HIV prevention, care and treatment work with FHI. But in that time, as the organization grew, I've worn a minimum of 7 hats. So I feel like I've had multiple different jobs. So that's what brought me. And I think I just never looked back after I started like my first week at USAID.
Great. Thanks, Laneta. And as Laneta said, Kirsten and Laneta and I do have some commonality here, and I even have some commonality with Luis at this point. My training is also in physiology at Vanderbilt University. I got my PhD there. But my interests in reproductive biology stem from when I was a graduate student. And actually, I worked on invertebrate fertilization. I worked with sea urchins, and then ultimately did postdoc out at Scripps Institution of Oceanography. And so my background in reproductive biology was in marine animals for the most part. We did some work in mammals while I was at Vanderbilt, but had the fortune of being offered and accepted a job in the Department of OBGYN at the University of Pennsylvania by Luigi Mastriani, who Luis knew very well, and Celso Ramon Garcia, who has a great history in the development of or in the clinical trials of the first birth control pill. And so I was there at UPenn for about 20 years, and my research was in mammalian gametogenesis, fertilization, early pre-implantation development using modeled, animal models, mouse. We also did some work with the folks at the School of Veterinary Medicine. But early on in my stint at Penn, I also helped start the laboratory for IVF there, one of the first laboratories in the United States. And so, my interest in reproductive biology stemmed when I got into mammals, into humans, not only from infertility, but during the time that I did my research in using animal models. The reverse side of that is in infertility as well. So I view fertility and infertility as two sides of the same coin, and had a wonderful career and time at the University of Pennsylvania. But I was very interested in understanding how my research or research of others could be translated into products, and was fortunate enough to be offered a position at Wyeth Pharmaceuticals, heading up a new group in non-hormonal contraception for both females and males, and worked there for a period of 6 years. Really loved it there as well. I have to admit that every opportunity I had, I truly loved, because I learned so much from all of those different opportunities. I love the pace of the work in industry, and what we were doing, but I also saw the downside of the industry, and we can talk about that as well. As that Wyeth was eventually positioning themselves for a takeover by Pfizer, and after 6 years, I was out of a job at that point. Went back to academia at the University of Kansas Medical Center in more of an administrative position, and again learned a lot during that time. But I was always interested in getting back into product development in the reproductive medicine space, and specifically in contraceptive development. And it was just fortunate enough, I had first met Laneta back in 2004 at a National Academy of Sciences meeting. And we happened to meet again when I was at the University of Kansas at a Gates Foundation meeting over in New Delhi. And we got talking, and Laneta was talking about making an application to the Gates Foundation to start a new program in contraceptive technology innovation. And asked whether I would be interested in joining her in forming this new group at FHI 360. And that was 9 years ago, and I've never looked back. I've thoroughly enjoyed it. What I've learned from this is doing product development in the global health space offers a whole new range of challenges that I hadn't much thought about in industry, and certainly didn't think about in academia. So that's kind of my background. I've kind of been all over the place, and but I've enjoyed every part, because I think you learn from all of your experiences. So I'm going to ask the panel, since they gave a very nice description of their background and what they're currently doing, is if you could offer what tips and advice would you give to students and young professionals wanting to get a job in your particular sector, number one, and what is the typical job progression in the position that you're in, and what you like and what you don't like about what you're doing. And so Kevin, I'll start with you again.
Yeah, thanks. So I guess I can start with maybe likes and don't likes. I think, I've only really experienced the academic and the government background. From an academia standpoint, what I did really like was having my hands on the actual work on a day-to-day basis, actually running the experiments and designing them, and kind of really being in charge of the direction of that experimentation. What I didn't like was the sort of constant pursuit of funding and writing grants and kind of trying to justify the importance of your work and how it fits the sort of overall strategy of contraceptive R&D or whatever it is that you're working on. And I think that kind of transitions in a bit to what I like about the government space, is that although I don't get that day-to-day work where I'm actually doing the experimentation, as a funder, we put out different kinds of RFAs, and organizations like FHI and others will apply and receive funding to do the actual work. What I do kind of get to do is look at that overall landscape and figure out what gaps might exist. Where could we put money to sort of strengthen the R&D process, and kind of look at that whole picture point of view, and have some control over, where funding is placed, and where we think maybe priorities can be advanced the quickest. So it's kind of nice, because I took that part I didn't like and kind of went the total opposite with it, and was able to pursue it from a different lens. And it's given me a new perspective on sort of the grant process. And I've really appreciated that. Another thing that I like with working in the government is that I was never someone that really enjoyed going too deep into one topic. Even with my dissertation and others, I was using drug delivery systems for a range of different diseases. And I think working in the government allows me to sort of focus on the contraceptive R&D space, but also kind of pursue passions as they pop up. And so, other things that I've been able to do is, work on the COVID response with, getting ventilators and testing and things like that out to partner countries. I worked on the Afghanistan drawdown, helping to process immigration papers for refugees, and just different things like that are kind of outside the science that I think have a global importance that I'm able to kind of get involved in for, a few weeks or a month at a time and pursue. I think, as you've probably guessed from this topic, one of the really good ways to get into USAID or government organizations is through the AAAS fellowship. We have a lot of people that have entered through that pathway, but we also have a lot of different technical advisor positions that are available through contracting organizations and through USA Jobs and others like that. And I think there's so many pathways to getting into the government that, one of the things that we tend to see strength-wise is that we like people that have kind of experience on the global level. As Greg said, global health R&D is much different than domestic, and having that experience and that perspective coming into an organization like USAID is super valuable. We also, I think, tend to have a gap in sort of the regulatory side. So anyone coming in with some of that regulatory knowledge with regard to contraceptive R&D is also important. But yeah, if there's anyone out there that is interested in government space, you know, I think it's probably too long of a topic for this panel to go through all the ways that you can get in, but feel free to reach out. So
yeah. Thank you, Kevin. Kirsten.
Thanks, Greg. You asked a lot of questions. So tips and advice for folks wanting to get a job in the sector, and you know, the notes that I had written down really reflected one of the comments that you made in your introductory remarks, Greg, which is avoid getting too specialized, and find your passion. So, you know, being a generalist can provide opportunities, but as you said, you know, the workplace is becoming increasingly specialized. But that balance, and I think you put it quite well, Greg, of you know, between a specialist and an athlete, being agile, being flexible, adapting to changes in the workplace, really, really helpful. There's always somebody who can narrow in and focus on one tiny little thing, Kevin, to your point, but being able to have that broader perspective, being flexible, seizing opportunities. You know, the lines that you had on your first slide, Greg, were all straight lines. They were straight arrows. Yeah. I think many of us, our career pathways has been a bit more circuitous, maybe a loop in that arrow, maybe a right turn, maybe a twisting, winding path. But being open to those twists and turns in the path, I think, is really critical, regardless of what career path you're pursuing. Typical job progression. I mean, at the Gates Foundation, I think it's really, it may be fairly unique for product development, regardless of, you know, which aspect of global health, which indication, which disease area. There is, frankly, a bias toward hiring people who have product development expertise from industry. And, you know, Kevin, you had made this point earlier. It's sometimes like that fundamental, that functional knowledge that is seen as really the critical piece, and then, you know, being able to adapt. Are you delivering drugs for HIV prevention? Are you delivering drugs for contraception? But having that framework, I think, and that knowledge and background of how industry works is a bias of the foundation. I do not have that background, so I'm a bit of an outlier in our global health area, but, you know, do bring in years of experience of grant making, you know, that specialty, that specialized expertise in family planning, and as Kevin said, that, you know, more global viewpoint and understanding a little bit more than someone who has, you know, worked in industry in the US or Northern Europe, you know, a little bit more about how health systems work and don't work in developing countries, what resources are there, how we can, you know, adapt what we're thinking and understanding about product development for those different kinds of settings. You know, comparing philanthropy with U.S. government, I loved working at USAID for a lot of the same reasons that Kevin listed. One thing I didn't like was the politicization of women's health, and that constant sort of defending the existence of the Office of Population, defending work in contraceptive R&D. You know, and I get it, right? We're funded by U.S. taxpayers. We're accountable to the, you know, to the taxpayers, to Congress, you know, for budget oversight. But I have to say, working at the foundation, it's a relief not to have that same political struggle. The foundation is a nonpartisan organization, although our leadership has been more vocal, I would say, in the last 4 or 5 years about, you know, what they feel is sort of right or wrong pathways, or, you know, where they can support the government in decisions, and where there's been less support of government decisions. there's a lot of money at the Gates Foundation, so that's been really, it's really a treat, you know, going from U.S. government and WHO to, you know, places where I would say contraceptive R&D is accepted, but, you know, the Gates Foundation, it's an area that's really embraced and supported and very generously resourced. So we have a lot of flexibility in you know, the kinds of projects that we take on. The foundation is a risk-taking organization. So we can take big bets, and as long as we can say, well, we understand the risk, here's how we mitigate it, here's how we mitigate the risk, but we think the benefit is worth the risk, then we generally have, you know, support, as long as what we're doing is kind of well thought out and well understood what that risk-benefit ratio is. So that's been a real kind of mental switch, you know, going from a really resource constrained environment to a resource open environment, and allowing that to kind of drive creativity and risk taking in a different sort of way. I'll leave it there. Thanks.
Thank you, Kirsten. It's very, very helpful. So, Luis, can you make just a couple of brief comments about that, about the questions that I posed?
I work in a university with the advantage that the University of Campinas is very open, and you can work in abortion or in contraception without interference of the director of the medical school, of the chief of the department. They are very, very open. Nevertheless, the most barriers to work is the bureaucracy of the university. You need to deal every day with the bureaucracy of the university to obtain the approval of the project, to discuss with the ethical committee by the comma or by the word that they don't like, etc., etc. The other challenge for us is funds, because you need to be in advance, 2 or 3 years in advance, to prepare budget for the next 2 or 3 years and to discuss with FHI or with the Gates Foundation, etc., projects to be supported for us. But not at any time our interests are exactly the same interests of the FHI or Gates or WHO, etc., etc. At the present time, we are in a rich period, because due to the COVID-19, we have several projects supported by WHO because they are interested in obtaining data from Brazil, because, you know, was a disaster in COVID-19. Consequently, we have projects with pregnant women, we have projects with health system, with qualitative system, with provider and user of the system. We have a project with qualitative reproductive health questionnaire, etc., etc. But you know that this is a challenge every day and every week and every month to discuss, because for many teachers, they are comfortable with the budget from the university, but I am not comfortable. I see so that we need more money to support staff, to support statisticians, to support translation of our paper into the English, to support payment of the publication, etc., etc. And consequently, the people who join this kind of career must be prepared to fighting every day with donors, with bureaucracy, etc., etc. Over.
Thank you, Luis. Laneta, could you make a couple of comments?
Yeah, I'll try to. I was looking at my notes because I'm trying to not be redundant. I think I completely, many of the comments that Kevin and Kirsten said, and also Luis, I really have this absolutely the same mindset on. When I worked at USAID and US government, I liked it there for for the reasons that Kevin talked about, and that being a donor was an opportunity for you to be in a position of both interacting with some of the best and coolest people in the world working in this space and making decisions about supporting that work. At being in the NGO sector like FHI 360 is, it is a constant challenge to secure funding, to convince donors, to collaborate with donors, to convince them that certain investments are good investments or are strategic investments. So there's that constant pressure that you don't have when you're in the donor community, but more like when you're in the university community. So I think that's been really a balance. One of the pieces of advice, I guess, that I would have, and Greg, I think this is part of your question about like career progression, and that is that, you know, that delicate balance of breadth and depth is really critical, and it's been made, the point has been made by all of the panelists, thinking about if you don't have a depth, you know, you're kind of limited in certain areas. But if you don't have a breadth or a curiosity, a willingness to always to continue growing, then that creates additional limitations. So I think that just putting that kind of hat on and then being patient. I think none of us on this panel really just kind of came into the field and then all of a sudden we're where we were. We all had, you know, fairly long progressions with twists and turns, like Kirsten said, and each one of those we've learned. So Greg, I was going to comment, but I think maybe you can. And one of the challenges that comes from the NGO sector is building those pharmaceutical partnerships. It's the early funding and then the partnership building. And perhaps, I don't know if you were going to talk about that or not. I can just pass that back to you.
Sure. Thanks, Laneta. And I know we're getting short on time and want to have just a couple of minutes for questions from the mentees. And what I would recommend, since we are short on time, is that you know, Emily has our contact information. So you know, if you have a question, you're not able to, you know, discuss this at this meeting, please reach out to the individual panelists. I'm sure they'd be happy to you know, answer your questions. So I would ask that we do that. You know, I think that you know, with regard to my career progression, I've been in, you know, the academic space, the industry space, and the NGO space, all of which have their individual challenges. There's bureaucracy in all organizations. That can always be a frustration. I learned to appreciate that a little more when I was in more of an administrative position at the University of Kansas. But I think that with regard to one of the challenges I alluded to or answered, follow up on Laneta's comment in the global health space, is engaging with industry to help them understand the importance of what we're doing in global health, and how ultimately that is to everyone's advantage of making sure, in this case, that contraceptive products are made available to everyone, you know, globally, regardless of the wealth of their country. And so it is a real challenge, and in having discussions with the pharmaceutical companies about that, because they have to weigh their you know, their responsibilities to their shareholders, you know, with what they can do in the global health space. But I'm seeing that, you know, more and more companies do recognize the importance of this. Not only from providing products, but it's great public relations for these companies. I want to speak just to finish up with regard to progression, and I can talk about progression in industry. And I've talked to the mentees that I've been working with about this. Is that you know, you can come into industry. Large pharma is very much different than small pharma. In many respects, and you know, I can talk about that if you have specific questions. But there is an opportunity, for instance, if you come in as a scientist in pharma, to move into other areas. I have a colleague that I work with at Wyeth who was a bench scientist for a number of years there and became very interested in the regulatory side of things and is now pretty high up in another large pharma company in regulatory now. Other folks that I know have gone into clinical from the basic science side and also into project management. So there are opportunities. It's a little more structured in large pharma than in small pharma, but those are some of the differences. So I'm going to stop there and please let's open this up just for the last couple of minutes to the mentees if they have any specific questions. And as I said, if you have a question, we don't have an opportunity to address it, please reach out to the panelists. We're all happy to answer your questions. So I'll open it up. Emily, you want to coordinate this?
Sure. If you have a question, you can feel free to type it in the chat or raise your hand or just feel free to unmute.
Hey, Emily, my chat is disabled. I don't know about for other participants.
Yeah, mine is too.
So, okay, let me try to figure that out. But if you do have a question, feel free to unmute yourself.
Yeah, mine actually works. So there might be something.
Maybe it's a FHI,
external.
Yeah.
Thing.
Can I also propose that Emily, you maybe can collate questions if folks can just email questions to you, and then we can just have kind of an FAQ document that we can all contribute to.
That's a great idea.
I'm happy to do that. I'll volunteer others as well, but I'll volunteer myself.
Great idea.
Yeah,
great
definitely.
idea.
I'll follow up with everyone after this to see if
excellent. Excellent.
So I've got a question that I'll just ask. So I guess not in the positions you guys are in, because you're obviously in higher positions, but in more like your teams, do you hire PhD students or people who are graduating from PhDs? And what kind of skills do you specifically look for them to be demonstrating?
I can start with that. Sure. At FHI 360, we absolutely do hire even new PhDs and then typically into the project management track and then mentor them up. We have also a fellowship program with the University of North Carolina, and we have an internship program with Duke University, which is one thing nice about being in the Art Research Triangle Park area, where we have fellows that come in and work with us either for 1 year or for a shorter period of time. They can work on our teams, get some exposure. We get to learn about them, and it's just a total win-win for us. So that's something that FHI 360 does. But definitely we hire new PhDs, even if you don't have a depth of experience. You have to have interest, dedication, and hunger. Thanks.
The Gates Foundation also has what we call Global Health Fellowship Program. I think that's been suspended the last couple of years due to COVID. And there are also internship programs for Masters of Public Health MPH students, and recent MPH also being reimagined now. So will be relaunched in another couple of years, or hopefully sooner than that. But there are kind of trainee pathways at the foundation as well.
Yeah, and I'll just say at USAID, we also have paid internship opportunities that I think internship is not the greatest word for it because it generally takes master's and PhD level individuals. But for the biomedical team, we have PhDs, master's students, a whole range of individuals. I think what's really important is looking at the job advertisement and just seeing if you meet the scopes. There's generally no specific degree requirement or anything like that for the positions, but yeah, so we definitely have a range of people with differing experiences as well.
I can speak to industry. As far as industry is concerned, in large pharma, some large pharma have their own postdoctoral programs, but there's also opportunity to get in on the ground floor without a postdoc, working at at the bench, for instance. Smaller pharma, I think it's the same. They're not going to have formal training programs like that. But I think there are opportunities for folks that haven't done postdocs in smaller pharma. And as Laneta said, they're looking for people, you know, who are bright and who are aggressive and are really looking to, you know, help and develop their career. So.
Great. Thanks so much, everyone. And this whole thing has been really helpful. So thank you.
Sure.
It's a great question, Kirsten. Thank you.
Yeah. Yeah.
Thank you.
Any other questions? I know we're a little over. If not, I think Kirsten's idea of please send your questions directly to Emily, and you know we can get them collated and you know sent out to the team, this group here, and we're happy to to respond to all your questions. And so I think with that, I want to thank all the mentees for attending, and we hope that this was a helpful session. Certainly look forward to hearing your comments about this session. You know, should we run other sessions like this? Any advice would be helpful as we develop this program. And again, my thanks to the panelists, Kevin, Kirsten, Luis, and Laneta for your time today. Thank you so much.
Thanks,
Thank you,
everybody.
Greg.
Yeah, thanks everyone.
Bye-bye
Thank
now.
you, Greg. Thank you very much.
Bye.